thank you very much. Kind of a different direction at the end of the day.
Yeah, it is a different direction.
Can you give any examples of things that are out there, maybe not obesity or weight related, but that have used this individual sort of building up?
Well, all the companies that make these devices are thinking about doing that, right? So the Fitbit type of device knows what you're up to at a high level in a general sense. And then they're starting to play around with ideas of having you set goals on a daily basis, right? And then you're trying to achieve those goals on a daily basis. What they're not really doing yet is making that feedback respond to what you're doing in the middle of your everyday life, right? So let's say I have an application and it says, let's say you have a Fitbit. If you're wearing a Fitbit now, it knows you've been sedentary most of the day. And if it's just sitting there all day saying, get more movement, move more, and you're stuck in this room, that's actually more annoying than anything else, right? Because you can't do anything about it. Whereas if it waits until a moment in time when it's actionable for you to do something and it provides you with the feedback's going to be more effective. So what many of us who are building the technology that tries to figure out what you're up to are doing is we're trying to make that richer and richer so that the computer can be quite strategic about when it would provide you with information or when it would ask you questions. And
it sounds like those shopping and marketing apps that track your buying pattern and your search patterns, and they get more and more information about you, and then they send you direct target ads.
That's a good point, right? So they're very sophisticated about what they do, and you probably all at this point had the experience, sort of a freaky experience, where you were interested in something, you were searching around for it, and then later you're doing something else, and it's just constant. You got to buy this thing, you got to buy this thing, right? And that's because they're doing exactly this. They're building up pretty sophisticated models of what it is you're looking for and interested in. And sometimes it then shows you something you didn't think you needed, but then you realize, oh, I need that thing, right? Because you were looking for something else similar. So industry is doing that. Health researchers need to do that. To do that really well when it comes to everyday health-related, sort of obesity-related, overweight-related behaviors, diet, exercise, taking medications, all those things, to do that really well requires that we have better the devices work better than they currently do, but there are a lot of people working on it, so it's going to happen.
It's going to happen. Yeah. Go ahead, Jerry.
Thank you so much for your creativity and innovation. This is exactly what we needed as we're looking at what the future could hold. And I recently went to an interesting medical technology conference where there's a working prototype of something, if you've ever seen Star Trek, called the tricorder. And the tricorder, if any of you have seen Star Trek, Bones used it, right? And it scans you from head to toe. And there's a working prototype that actually can say if there's sort of hot spots and areas of concern for infection for you to seek care. Pretty interesting. But I think it really raises to light the notion that, I go back to what one of your colleagues said, maybe BMI is not the most sensitive or specific measure, but through emerging technologies in the future, there will be the potential, and I think a very real potential, to use a sensor-based technology to look at adiposity. And if we look medically, it's adiposity that drives poor health outcomes rather than a specific BMI, although that is our gold standard right now, and that's why we focused on that in our data gathering conversation. So right now I have patients who are sending me EKGs from their phone because it's quite easy to do. You just put your thumbs on the back of the sensor, creates an EKG, it's transmitted to my office. So that sensor technology is being used already. And I think that you raise the possibility that when we use small data, it's not really small, it's really getting at the level of the individual, which is quite important.
Yeah, so again, for sort of understanding if somebody's overweight or obese, that's something that changes really slowly, right? But all the factors that impact that are things that are happening actually quite quickly. I'm making decisions on all the time that are in the long run having an effect. So the more sort of detail we have about that sort of intensive longitudinal data, the more detail we have, one, we can get rid of a lot of the noise. So even if I'm measuring something and it's pretty noisy, if I'm measuring it continuously, eventually I can get rid of that noise.
Right.
Right? And figure out with more and more detail, that's what that person does. So in my case, if I look at data from my phone and sensors that we wear in my lab, but you see there are sort of patterns in my day. I get up in the morning and then I go for a walk, and you see every single day there's a walk in the morning, there's a walk in the morning. And the type of thing that we're working on is that it identifies that there's that thing that's some sort of walk, and then it would ask me and say, what is that? And then all I have to do is once say, I'm walking my dog. Right? And from that point on, the computer can basically say that looks like walking the dog from before, right? And so now it knows not just that I'm walking my dog, which changes if you're developing an intervention, what you might ask me to do or not do at that particular time. So we're really trying to get at these very, very detailed models that, again, won't impact overweight or obesity measurement, but in the long run would really impact how we might think about interventions.
Thank you.
The other thing I'll mention is that at the community level that was brought up earlier, I think it might be more viable to have a strategy where you say to the community, there's an app, put it on your phone, right? And maybe there's a lottery or whatever, something that's incentivizing them in addition to just public service. But it may be possible to get very quick uptake on these apps and get things distributed throughout the community. And it might be possible that they could then get a really great measure of just BMI across the community, where you're doing things of having people check other people's measures in some sense, and you get accurate measurements. So I think that's something that's worth thinking about.
Jackson.
Thank you for your presentation. I was just wondering, what are your thoughts on cost? You mentioned a lot of potential incentives, like when you're talking about crowdsourcing pediatricians, you also included, incentivizing those people who would be involved either in obtaining the measurements or submitting the measurements. And even when we think about Text for My Baby, for example, if we're to do text for BMI, who would be bearing the costs? Is it something that you just imagine is being done by public health departments, or is it by the private sector?
I think it completely depends. I mean, okay. So if it's just a mobile phone app and you make it's clever enough that people say, hey, I want to do it because it's fun or it's engaging, then it would really, in the grand scheme of things, cost you very little, because you can assume most people are going to have phones that you have to develop that, which is a cost, right? But then the deployment of that is relatively inexpensive.
So you see the development being done within public health settings or by local organizations?
How that gets done, I don't know. It could be researchers, it could be a little company, it could be some sort of non-profit organization. I mean, I was throwing out a lot of different ideas, so I think it's very dependent on the idea. If you go to Google with a good idea, you might get buy-in from the company, and they might say they'll do it, right? It doesn't really cost them very much money, and it all depends on the complexity of the app. I mean, it's really easy to write a little app that just lets people enter information. It's much harder to make an app that's really compelling and exciting and gets kids scurrying around their school saying, let's enter our weight and height and into this app. And so I don't think we can really answer the question. I just think it's important to try to think a little bit creatively about how to get the data beyond the ways that we get it today.
Thank you very much. We really appreciate it. And instead of taking a break, I think Sherry wants to come up and kind of close the day off. I think we're all losing steam here. And so, Sherry.